Multiple sclerosis, MS, is a chronic, often disabling disease that affects the central nervous system, CNS, which consists of the brain, spinal cord, and optic nerves. MS occurs when the immune system mistakenly attacks the protective sheath, myelin, that covers nerve fibers, causing communication problems between the brain and the rest of the body. Over time, this can lead to permanent nerve damage or deterioration. Causes and risk factors. Autoimmune response. MS is considered an autoimmune disease, meaning the body's immune system attacks its own tissues, specifically the myelin in the CNS. Genetic factors. Individuals with a family history of MS have a slightly higher risk, although it is not directly inherited. Environmental factors. Low vitamin D levels, smoking, and viral infections, such as Epstein-Barr virus, are linked to increased risk. Geographical influence. MS is more common in regions farther from the equator, possibly due to less sunlight exposure and lower vitamin D levels. Age and gender. MS usually affects people between ages 20 to 50 and is more common in women than men. Types of multiple sclerosis. MS is classified into 4 main types. Relapsing remitting MS, RRMS. Most common form, 85% of cases. Characterized by episodes of new or worsening symptoms, relapses, followed by periods of partial or complete recovery, remissions. Secondary progressive MS, SPMS. Follows an initial RRMS course. Gradual worsening of neurological function over time with fewer or no remissions. Primary progressive MS, PPMS. Steady worsening of symptoms from onset without relapses or remissions. Accounts for 10 to 15% of MS cases. Progressive relapsing MS, PRMS. Rare form. Steady worsening from the beginning with acute relapses. Symptoms of MS. Symptoms vary depending on the location and extent of nerve damage. Common symptoms include neurological symptoms. Numbness or weakness in one or more limbs, typically on one side at a time. Tingling or electric shock sensations. Loss of balance and coordination, ataxia. Vision problems. Blurred or double vision. Optic neuritis, inflammation of the optic nerve, causing temporary vision loss. Fatigue and pain. Chronic fatigue affecting daily activities. Muscle spasms, stiffness, or pain. Cognitive and emotional changes. Memory issues, difficulty concentrating, and slowed thinking. Depression, mood swings, and anxiety are common. Other symptoms. Bladder and bowel dysfunction. Dizziness, tremors, and speech problems. Diagnosis of multiple sclerosis. Diagnosing MS involves multiple approaches because there is no single definitive test. Medical history and neurological exam. Assessment of symptoms, reflexes, muscle strength, coordination, and vision. Magnetic resonance imaging, MRI. Detects lesions in the brain or spinal cord caused by demyelination. Lumbar puncture, spinal tap. Analyzes cerebrospinal fluid for abnormal immune proteins associated with MS. Evoked potentials. Measures electrical activity in response to stimuli to detect nerve damage. Treatment and management. While there is no cure for MS, treatments aim to manage symptoms, reduce relapses, and slow disease progression. Disease-modifying therapies, DMTs. Medications that reduce immune system attacks and prevent relapses. Examples include interferons, glatiramer acetate, and monoclonal antibodies. Symptom management. Physical therapy for mobility issues. Medications for muscle spasticity, fatigue, pain, or bladder problems. Lifestyle modifications. Regular exercise to improve strength and coordination. Healthy diet rich in vitamins and minerals. Stress management and adequate rest. Emerging treatments. Research is ongoing into stem cell therapy, remyelination drugs, and novel immunotherapies. Prognosis. MS is highly variable. Some people experience mild symptoms, while others may develop severe disability over time. Life expectancy is only slightly reduced for most patients with MS due to advances in treatment. Early diagnosis and treatment can significantly improve quality of life and slow disease progression. Key points to remember. MS is an autoimmune disorder affecting the CNS. Symptoms are diverse, including neurological, visual, cognitive, and physical issues. Early diagnosis using MRI and neurological exams is critical. Disease-modifying therapies help control progression and relapses. Lifestyle and supportive care play an essential role in management. Conclusion. Multiple sclerosis is a complex and unpredictable disease that can profoundly affect an individual's life. With ongoing research, better treatments, and early intervention, many people with MS lead productive and fulfilling lives despite the challenges posed by the condition.